with the Croaky Conference Reporting Service, talking to Marianne Williams, and you're from the Aboriginal Health Council of South Australia, and you've been presenting on 2 workshops that you've been delivering. Can you tell us about those?
Yeah, so Trent Wingard and myself today presented here at the ATRAC conference in Sydney. We presented on Our Lungs, Our Mob and on raising awareness for women's business cancer. So 2 different workshops that we've been funded through Cancer Australia to deliver around Australia. One about raising awareness of lung cancer and the other one about women's business. And it's really about early intervention and getting the awareness out there of what cancer, what symptoms to be looking for, and really to get early intervention as early as possible to be able to get support and help for people that are diagnosed or maybe may think they may have cancer, risk of cancer, or may have developed cancer.
Now, you said you've actually been driving many thousands of kilometres, I think. Where have you been delivering these?
Myself, so as I said, the Aboriginal Health Council have funded to deliver this around Australia. I've been to the Northern Territory a couple of weeks ago, over here to the West Coast, to Sydney, and heading up to Queensland. There's a few other staff there at AXA as well, so a lot of Aboriginal staff that we've got at Aboriginal Health Council, and a lot of our registered nurses as well. So we're delivering around Australia, and going to every state really, and delivering the awareness and delivering the 2 workshops.
And what are the issues you have to most try and address for those communities?
I guess the challenges we've got is trying to link up with people on the ground to raise awareness, to get people to, because, you know, I guess cancer is not the most in topic that people would want to come and hear about. So it's trying to get people on the ground that are working in our services, trying to get the knowledge to them and using people on the ground as assistants to get people to our workshops. The idea with the resource, I mean, it's a really clever resource because Cancer Council developed it in the way that we are, I guess we're the mechanism to get the resource out there. But the idea is to work alongside Aboriginal health workers or now tackling smoking teams, people on the ground that then can use the resource. It's a really easy step-by-step resource. It's great for community, for health workers to get use of it, because then we can assist them to deliver it, and then they hopefully will run with it in their communities. But I guess the challenge is really trying to get the relevant people to the workshops with a limited budget, of course, and lots of travel, tyranny of distance.
When you said it's smart, what is it particularly that makes it smart?
Well, I think because it's user-friendly, there's lots of different interactive resources, so I guess the engaging thing is trying to get people to talk about cancer. So a lot of the resources in the package, we've got Archie Roach's, for example, his DVD, stories around ambassadors that have actually thought they may have had cancer or have had cancer, what they did, their stories. So it's using those local stories and Aboriginal people to drive those stories and getting that awareness out there. So a lot of different resources. Each workshop I've done is differently depending on where you are. You adapt it so that the resources are really easily adaptable to whatever. You could be talking around a barbecue, you could be in a remote area where you don't have access to PowerPoint. A lot of the times we use the PowerPoint, but you have to learn to adapt to each area. But the resources are really clearing and very user-friendly for anyone to be able to use. And it's not rocket science. You know, I always say I'm not a cancer specialist, but I'm here to deliver this education around awareness of cancer. And really, I guess for women's business, it's getting those two yearly pap smears and 2 yearly mammograms to looking at preventing and being able to pick up cancers early, because that's the problem, I guess, with Aboriginal people, Aboriginal women particularly, not having those 2 yearly health checks and pap smears and mammograms. When their cancer is diagnosed, it's sometimes diagnosed quite late, which it causes problems to being able to give them treatment and to beat the cancer.
And what do you find? Do you find any messages particularly work in those cases, or indeed ways of accessing those communities? What's working better for you?
I think, again, trying to engage with local people and trying to use ambassadors. Okay, we've got Archie Roach, who's a national ambassador, but using local people. And each group's different, and it's using a lot of the aunties, a lot of the elders who I work with. It's great having them at the workshops because they're then able to, they know the importance of having a pap smear every 2 years and having a mammogram. So it's working with them, and they go then home. Some of the take-home messages we talk about at the end. What would you do differently now? They all say, I'm going to go and tell my granddad, I'm going to tell my niece, I'm going to talk to my family about the importance of having health checks. And the same with lung cancer. That the team delivering that workshop say the same. It's about getting that awareness and making sure that that those messages are taken home about getting a health check. If the cough's a bit different, or if you're coughing up blood with lung cancer, we know it's the highest incidence of Aboriginal cancers in Aboriginal people. So it's making sure that anything different, those take-home messages, using the ambassadors, or using the elders, or the ambassadors at the workshops to drive those messages works really well. And obviously linking in with the right people in the services. Many of our services are really stretched and under-resourced. So it's working with trying to identify the right people that can assist us with the workshops to get people there.